Thank you. Thank you for having me, and thank you for being here on your Sunday, and for the introduction. So I've been in private practice for a long time, and I tend to specialize in working with people who have various chronic illnesses, including IBD. And I am also a former owner and now a consultant at the large group practice, Seattle Psychology. So when I was asked to give this talk, I thought, well, mental health and IBD, this is such a huge topic. How do I narrow this down? I thought I could talk for hours. And don't worry, I'm not going to talk for hours. But just a little bit of self-disclosure. Although I don't have IBD, I do have another autoimmune disorder, lupus. And I was diagnosed when I was 19. And I probably didn't handle it too well at first. So I'm thinking about what questions would have been helpful to ask myself and kind of set the stage for mental health for someone who's newly diagnosed or who's struggling in this area. So I kind of came up with these big questions. How do I maintain good mental health and balance despite IBD? What do I do if I'm having a major mental health problem? And how and where do I look for help? So I've included a few memes in this talk because I learned to speak meme. Hope you're not offended by language. I find that they get a point across in a nice punchy way and get at some humor, but with all good humor, it gets at sort of the pain underneath, right? So IBD is a huge stressor that people deal with. And when we have a huge stressor, we have how we have our reactions to it, how we perceive it, makes a huge difference in how we handle it. So IBD can be both an acute and a chronic threat. Acute, dealing with my symptoms today, or a new pain, or a procedure. Chronic threat, of course, being how it's chronic, and it's this grinding stressor that's in the background even when it's not flared. It impacts your whole system, and within this stressor, there's all these different stressors contained in there. Surgeries, procedures, pain. I'm sure you know the drill. So one intervention that you can start with is very simple, and you can do this right now along with me, is taking your stress temperature. So if you think of having a stress thermometer that goes from 0 to 100, and if you take a moment to say, where are you? Take a deep breath, kind of picture where you fall on this stress thermometer right now. And when your stress thermometer is high, how can you take care of yourself? And so that might be as simplistic as taking 5 nice, deep, diaphragmatic breaths, which sounds so simple, but if you do it, and you can do it right now, you may notice that it ratchets down your stress thermometer a couple notches. That's a good start. So a lot of the things I'm talking about here relate to listening to yourself, listening to what you need, and taking ownership of what you need, and finding your voice. To be able to express what you need and access it, you need to really tune in and accept what are your needs, what are your emotions. So I included this little bright flower here because it contains all the emotions. It's your joy, your anger, your guilt, sadness. And you can see it's all part of one system. We are hardwired as humans to have these emotional systems. And unfortunately, you can't have all the positive emotions without the so-called more difficult ones. It's all the same thing. Emotions guide behavior, they guide motivation. They can be very crucial. They help you connect in relationships. They can also be very hard to deal with. So if you're having strong emotions in response to huge stressors, you can know that you're just being a normal human. Sometimes new clients will come in and they'll say, oh, I feel like I'm losing it, or I shouldn't be feeling this way. It's like, no, you're being human. Big emotions are not a sign of weakness or being too sensitive. And it actually takes bravery and strength to be with and express difficult emotions. We know that bottling up emotions or trying to numb them can have negative consequences. And there are emotion regulation skills that you can learn that help you feel more in control, that aren't about suppressing them, but are about not getting bowled over by them, where they feel so overwhelming. And this is another aspect of listening to yourself and finding your voice, what I call the mindfulness check-in. And it's similar to the stress temperature. It's kind of finding your "you are here" on the map. And that enables you to say, okay, this is what's happening in this moment. Okay, now where do I go from here? So you can check in, just take this moment to step out of the stream of your experience and say, what is going on with my breath, my body, my mood, and my thoughts? And trying to take note of what is instead of focusing on what you wish it was or how it used to be. You know, all we have is this moment. That's our reality. And so then you can find ways to maybe make your experience better. So we have emotions. That's okay. That's great. But if you find that you're having a period of time where you feel consistently down, consistently anxious for a period of a couple weeks or more, you might be meeting criteria for a mental health disorder. Now, I just listed 2 up here. These are 2 common ones. There are others, and you don't have to have all of the symptoms there to meet criteria. But these are some common symptoms, and you can kind of scan them there yourself. But you might notice that among major depressive disorder and general anxiety disorder, there's some overlap. The poor concentration, lack of energy, sleep disturbance. So you can actually have both depression and anxiety, and they can sometimes feed into each other. And there's also overlap with medical illness, as far as the fatigue or the low energy, or maybe you feel low motivation because you're really sick that day. Maybe that's why you're having trouble concentrating. So I think it's less important to tease out exactly what is due to what, but noticing if you're having that consistent sense of suffering in life, because you don't have to live that way. So IBD, the stress response, and depression, anxiety, how do they relate? Well, we know that depression and anxiety are common. There's a rate of 60 to 80% for people with active disease that was found in one study. We know that it's multidirectional, or a feedback loop. There's evidence that stressful life events may increase the risk of flares or may precipitate the onset of illness. So stress having some role in causing illness. We also know that the inflammatory process of the disease itself may directly cause anxiety and depression through common inflammatory pathways. And then, of course, there's all of the reaction to having illness, which can also cause depression and anxiety. So it can kind of feed back into itself. Grief is common. There are a lot of losses that can be associated with IBD that are maybe harder to pinpoint than the typical loss of losing someone in your family or that kind of loss, but it's losses that might be more invisible to people, like a loss of a role in your life or a physical ability or the type of career you expected. These are different kinds of losses, but they're real losses. And sometimes processing that with someone can be very helpful. Medical trauma is also a factor. Having something going very wrong that's very, very scary, an emergency visit, terrifying pain during the middle of the night, a procedure that doesn't go right. And sometimes that can even reach the level of PTSD just from your experience in medical settings. And we know that mental health issues may make it harder to manage the disease. So I'm having a mental health crisis, now what? Come on, inner peace, I don't have all day. Well, the first thing human beings do when under threat is, besides get scared, is think about who can help me, who is in my support system, who are my supportive people, am I safe, understood, cared for? And we all want to feel like the women in this picture, held, accepted, loved. And some people have that. If you don't have that, then it can be harder. And, I notice that there are so many memes out there for IBD and chronic illness about how people just don't get it sometimes. Hopefully you can read those. And I think there's a lot of memes out there because it's, a common experience. IBD is largely invisible, and it can be something that's very hard to explain or for other people to kind of clue into. And so this is another part of finding your voice. Asking yourself, what kind of support do I need right now? Because there are different types of support. Finding the supportive person who can listen with empathy and acceptance and avoids telling you how to fix it. Instrumental support, maybe that's a person who is really good with giving you a ride or helping you research a doctor, task-oriented. Informational support, that might mean your medical provider, and that's here today. You're getting great informational support from all these wonderful speakers. I added the fun distraction person because maybe there's someone in your life who's not great with the empathy, but you share a hobby or they're great for a fun movie. So it's really important to look to the right person and be assertive and clear. And you can speak up for yourself and set some boundaries. Maybe you have to tell a friend, I can't be out late partying with you. That just doesn't work for me. But let's do this instead. How about that? You might have to be assertive with your medical providers and having conversations, writing your questions down ahead of time and making sure you get them answered. And you have a right to, of course, change medical providers if you don't feel like you're being listened to or like that person's kind of continuing to work hard on your behalf. And so if you have those trusted friends or partners who can provide emotional support, empathy, that's great. If you do or if you don't, still there is professional help out there. If you're religious or in a faith community, you might turn to a spiritual leader. There's therapists. I'm a therapist, so I might be a little biased here, but I think it can be very helpful to have a safe space, someone who's not personally involved with your life, to be able to process these things and say all the stuff. Psychiatrist or psychiatric social worker for medication. Medication can be another useful tool, probably not your only tool, but you could have a consultation to look at what are the options, what are the risks and benefits, how might this help me, especially if you're not finding that the things you're already doing are getting you out of a mental health crisis. Just a quick moment to note that accessing therapists right now in our area is challenging. We don't have enough for our rapidly growing area, and many therapists are full. Many are going off insurance panels. So if you're looking for someone and you need to use your insurance, it's a good idea to use your insurance provider list that you could find online. It's also a good idea to send out a bunch of inquiries at once, so you're not waiting to hear back from one person and spending weeks hearing from one person. And I personally find it easiest to respond to emails. So if a provider lists an email, that's a good way to do it, kind of blanket the folks to see if you can find someone with an opening. And if you're open to telehealth, you can actually see anyone in Washington State. So it doesn't have to be geographically in your area. We have to be licensed for Washington, but it could be someone in Port Townsend or someone in Yakima. It doesn't have to be within driving distance. So finding connection with other people who have IBD. So again, you're doing that today. You know about the Crohn's and Colitis Foundation, which has a support group finder. The Center for Chronic Illness is a nonprofit here in our area that has free support groups online. And again, you don't have to be geographically in Seattle to access those. I like the MyIBD, which is a website that tailors information and articles to your specific chronic condition. And there's support groups on social media as well. So it can be really helpful in normalizing to interact with other people who've been there. Just going to do a time check here. Okay. So some of the things that I work on with people in therapy and that you can work on no matter what, whether you're with a therapist or not, is looking at your thoughts and your emotions. Now, we tend to frame our worlds with our narratives, our stories. And by calling them stories, I don't mean that they're not true. They could be true. But the more important thing to ask is, are they helpful? When you tell yourself that story, do you feel better or do you feel down? Do you feel more of a sense of suffering? And some of the stories we know are unhelpful to get fixated on. They all pop up for us normally, no matter, these, not like you can never have these stories. They're part of being human. But if you get really stuck there, it can be harmful, like catastrophizing, the worst case scenario, the what if, comparison to others or to a past self, shoulds always have this flavor of judgment. I should be doing more. I shouldn't feel that way. And then being able to deal with your emotions as they come up. Feeling like I'm not going to suppress them. I can feel this emotion. I can name it. I can figure out how to work with it. Maybe I share it with someone. Maybe I kind of ride the wave of emotion, because emotions are always changing. So if you can think of it as a wave, and I'm going to take a deep breath, I'm going to let it flow on through rather than getting stuck. So basically trying to accept what's happening in the moment without blaming or shaming yourself, and looking for ways to improve the moment. So there's so many other issues that impact mental health. And, I can't spend significant time on all of them, but just to touch on fatigue, which can be very demoralizing for people, very frustrating. We know it's common. And something that I might work with people on is pacing, that idea of uptime and downtime. That I know it can be frustrating to not be able to do all the stuff you want to do in a day, but if you bake into your life this idea of I'm going to need to have some downtime if I'm going to be really active, I can think about how to dole out my energy over the day. Then maybe you don't wipe yourself out. Maybe you can work within what you got. Graded exercise. Exercise is a wonderful tool to help with depression, to help with anxiety, to help manage fatigue. But you have to work with where you're at. Really thinking about what is your capacity right now, and what can you do that doesn't end up being more fatiguing, that doesn't end up causing more problems. And that might be a very small amount, but it's a starting place, and you can increase incrementally. With pain, there are things you can do with the power of your mind to try to relax your body, or do mindfulness-based meditation, hypnotic analgesia. And of course, there's relationship with your body. It's very primal to think about what is going into your body and then what's coming out. And when you feel like you've lost some control of that, there can be a lot of shame, embarrassment associated with that. Adjustment to a different shape or ability of your body, or adjustment to having an ostomy and what that means for you. The impact on your intimate life. So all of these very intimate, personal things, what we try to do is shine a light on them. Things hidden away kind of fester. They can feel shameful. So we try to look for a safe space and a safe person to talk to, like a therapist, to normalize and bring into the light these situations that can cause shame and embarrassment. And of course, connecting with other people who have IBD. Now, I'll finish here with this idea of identity and values. When we have this big stressor of chronic illness, it can challenge your sense of who am I? If you identify with, this has been my role in life, this has been my job, or this has been my physical ability, or it can feel like this is who I am. And if you can't do those things anymore, or if they have to change, it can be very alarming. And you say, well, who am I now? Well, you are the same you. You're the same consciousness, having different experiences. All of these things in life can change, but you are not your job or your role or your disease or your collection of symptoms. You are this consciousness having these experiences. And so it can be more helpful to change your framework to, where do you want to be engaged? What are your values, and how do you still manifest them? And that might look different than in the past, but you can still find ways to touch on those values and find the things in life that feel meaningful, where you feel interested, and finding where you can have joy and pleasure, because you deserve all of those things. And sometimes you might even find some good things that can come out of the experience of illness that bring meaning to it. Not that anyone would choose to have a chronic illness, but it can help narrow down what's important in life. It can have you think about other people, have more empathy for other people with this experience or who have other challenging experiences. So maybe there's even some silver linings that you look for that can bring some more meaning to it. And I think that's about all I have for today. I hope I didn't go too over. But thank you for listening, and I'll take questions, I think, later at the panel, especially if you have questions about accessing services. I didn't get a chance to go into that too much, so I'm happy to answer those. All right, thanks.